we talk about cholesterol, it seems like statin drugs are soon to follow, at least in the same conversation. Explain what they are and how they work in lowering cholesterol.
Well,
what do they do?
Yeah, I mean, statin drugs, they're what we call them HMG co-reductase inhibitors. They involve a certain biochemical pathway in the production of cholesterol. Unfortunately, that same biochemical pathway is involved in squalene, which is another, biochemical molecule of the body. So statin drugs can do some good things, and they can do some very, very bad things. And when we use statin drugs, we must, and I have to emphasize must, use them with caution in any person. But the person or the population that has the most to gain are middle-aged men or men under the age of 75 with coronary disease, because statins in that age group have a little bit of magical corrections, because in a male with coronary disease, statins will help to really not reverse the process, but support the process, because I really do believe that men will gain from statins. Not the elderly, not so much women, and certainly not children.
What about those groups that maybe don't benefit, that are still on them? What are some of the long-term effects? Because you're not on them for a week or 2 weeks.
Oh, no,
you're
no.
on them for years and years.
I mean,
and years.
women who are on statins for 10 or more years get more breast cancer. I mean, that's been shown. I mean, both men and women on statin drugs can get, cataracts in the eye. That's been shown. Even certain cancers have been shown with statins. Certainly, memory dysfunction has been shown with long-term use of statins. So, I mean, you have to weigh the risks and the benefits in every patient. And the worst situation that I can think of as a clinical cardiologist is treating a 35-year-old woman who has a high cholesterol number. That is the absolute worst. Now, if that's a 35-year-old male with coronary disease, I would be the first to put him on a statin, not to lower cholesterol, regardless of the cholesterol. Statin drugs work as, they're very pleiotropic. They're antioxidants, they're anti-inflammatories. They have an effect on adhesion molecules. They thin the blood. They almost make the blood more like red wine as opposed to red ketchup. So in a middle-aged male with documented coronary disease, I would give a statin. With women, I really have not seen, significant effects. But would I give a woman a statin who's getting worse with coronary disease? Sure, I would. But again, I would follow her course very, very carefully.